Welcome to our channel, Everyday Budgeting. Today we are talking about medical debt, which is the main issue nowadays. Let's talk about it without wasting your time. In a recent poll, 25% of American adults admitted to delaying necessary medical care within the last year solely due to cost. That's a figure that could make anyone, sick or healthy, feel ill. So how did we get here? How can you protect your health without sacrificing your financial stability? Let's explore. A historical look at healthcare costs. For most of human history, illness was seen through the lens of mysticism and spirituality. Before germ theory, ailments were often attributed to divine punishment or supernatural forces. This perspective meant that healthcare was less about science and more about charity. Wealthy patrons and religious organizations funded medical care, treating it as a moral obligation rather than a commercial enterprise. Consider the hospital complex of Al-Mansur Qalawun in 13th century Cairo. Its financial policy declared, "The hospital shall keep all patients until they are completely recovered. All costs are to be borne by the hospital, whether the people come from afar or near, whether they are residents or foreigners, strong or weak, low or high, rich or poor, employed or unemployed. There are no conditions of consideration and payment. None is objected to or even indirectly hinted at for non-payment. The entire service is through the magnificence of God, the generous one." This approach, emphasizing care over cost, seems almost utopian by today's standards. But it's worth noting that medical interventions were far less effective centuries ago. Over time, as treatments became more sophisticated, the costs associated with healthcare shifted from collective responsibility to individual burden. The turning point, the 20th century. The modern American healthcare crisis can trace its roots to the 1920s. Breakthroughs like X-rays, advanced surgeries, and anesthesia revolutionized medicine, but they also came with hefty price tags. These innovations outpaced what the average person could afford. A 5-year effort by the Committee on the Cost of Medical Care sought to address rising costs. Their solution? Organize hospitals and practitioners into teams funded by private insurance or tax-supported compulsory plans. However, this plan was dismissed as Soviet and shelved. By the mid-20th century, the U.S. veered toward employer-sponsored health benefits, a system born out of World War II wage freezes. Nearly 90 years later, this model persists, setting the U.S. apart from other developed nations. Medical debt, a growing epidemic today. The financial toll of healthcare in America is staggering. A 2019 study by the American Journal of Public Health revealed that 66.5% of personal bankruptcy filings were due to medical expenses. For context, this scenario is almost unheard of in other wealthy nations, where tax-funded, universal coverage is the norm. Countries like Norway, Japan, and the UK have single-payer systems that ensure citizens aren't financially devastated by illness. While these systems have their own challenges, they spare patients the burden of overwhelming debt. Even nations with private insurance systems, like Germany or Switzerland, impose government-mandated price controls on premiums, and pharmaceuticals. Insurers also pay standardized rates for procedures, regardless of the provider's location. In contrast, the U.S. system, apart from Medicare and Medicaid, relies on voluntary private engagement, leading to inconsistent pricing and coverage. The role of insurance companies. The Affordable Care Act, ACA, introduced measures to curb excessive profits, mandating that insurance companies spend at least 80% of their revenue on patient care. Yet, loopholes remain. In 2022, private health insurance providers reported $41 billion in profits. This incentivizes rising costs, as higher medical bills translate into larger revenues for insurers. When insurance falls short, patients often turn to debt. Current estimates suggest Americans carry over $220 billion in medical debt. Unlike car loans or mortgages, medical emergencies leave little room for financial planning. An appendix rupture, for instance, doesn't allow time for price comparisons or budgeting. Protecting yourself. Practical steps. Although systemic reform is essential, individuals can take steps to mitigate the personal impact of medical costs. 1. Invest in comprehensive insurance. Even if you're healthy, prioritize securing the best health insurance you can afford. Familiarize yourself with its coverage limits and ensure your local hospitals accept your plan. Having this information readily available can save you time and money during emergencies. 2. Verify medical bills. Studies estimate that 50 to 80% of medical bills contain errors. Always request an itemized list of charges and cross-check them for accuracy. Mistakes like double billing or incorrect procedure codes are common. 3. Negotiate medical bills. If you receive a large bill, address it immediately. Hospitals often prefer to negotiate rather than sell unpaid debts to collections agencies. Engage directly with providers and don't hesitate to ask for discounts or payment plans. 4. Know your rights. Laws like the No Surprises Act protect patients from unexpected out-of-network charges. If you're uninsured, request cost estimates upfront and contest discrepancies. Research state-specific protections to better understand your options. 5. Seek financial assistance. Many hospitals offer charity care programs, and nonprofits can connect you with resources. Avoid converting medical debt into consumer debt, as this can worsen your financial situation. Beyond finances, the health impact. A broken healthcare system doesn't just strain wallets, it compromises public health. Despite exorbitant spending, the U.S. lags behind other developed nations in life expectancy, infant mortality, and chronic disease management. These shortcomings underscore the urgent need for systemic change. The power of democracy. While the current system is fraught with challenges, it's important to remember that policy shapes these outcomes. In a democracy, citizens have the power to advocate for reform. By engaging in electoral politics, you can influence decisions that affect your health and finances. Conclusion. America's healthcare system is undeniably complex, but understanding its history and nuances can empower you to navigate it more effectively. While systemic change is necessary, proactive steps can help individuals protect themselves in the meantime. And remember, your voice matters. Participate in discussions and decisions that shape the future of healthcare. Let us know your thoughts. Share your feedback, participate in surveys, and join the conversation about how we can create a healthier, more equitable future for everyone.